Welcome to 55 Plus, The Perfect Years, the podcast dedicated to helping you navigate and enjoy your retirement to the fullest. I'm your host, Roy Martinez, and today we have an exciting and groundbreaking topic to discuss regenerative medicine and how it can benefit those in the 55 plus community. Regenerative medicine is rapidly advancing in the field that aims to repair and replace damaged tissues and organs. It's offering new hope for improved health and longevity. From stem cell therapy to tissue engineering, these innovative treatments have potential to transition the way we manage aging and chronic conditions. In this episode, we'll explore the latest advancements in regenerative medicine, how they work, and what they mean to your health and well being. We'll also discuss practical steps that you can take to access these treatments and the potential benefits they can bring to your life. Stay tuned now as we dive into the world of regenerative medicine and discover how it can help you enjoy a healthier, more vibrant retirement. Welcome to 55 Plus, The Perfect Years. Our special guest today is Dr. Manuel Sanchez of McAllen. He has 48 years of experience in the medical field. Dr. Sanchez is a well-respected member of the medical community. I've had the privilege of knowing Dr. Sanchez since 1987. That's a couple of years ago. And a couple of years ago. We won't admit how old we really are, but I'm not afraid to admit it, though. And I know that in my experience, having known him, he's renowned for being on the cutting edge of medicine. He's considered in South Texas and northern Mexico as a leader in the practice of regenerative medicine and aesthetics. Dr. Sanchez, again, thank you for joining us on our program today. And let's just jump in with the topic of regenerative medicine. How long has it been an interest to you, and how long have you been practicing in this field of medicine?
Well, thank you for inviting me, and thank you, and hello everyone that's listening. And I've been practicing regenerative medicine for about 15 years now. And I started after I went to train at the Synergenic Institute in Nevada, one of the first ones that made this famous since the 80s. And I also am a member of the American Academy of Anti-Aging and Regenerative Medicine. So I'm certified by them as well. So it's been an interest after I got older. You start becoming more interested in the aging process, because most of the problems that we have in medicine and just in life have to do with inflammation. And degenerative things happen, in our joints and our skin, because as we get older, things just degenerate. They stop working like they used to. A lot of it is inflammation. A lot of it is just the circulation starts going bad. The amount of vessels we have decrease. You know that every day we lose about 1,000 neurons from our brain, die every day. Some people think it's even thousands and thousands more die every day. Of course, we're born with more than 1 trillion cells in the brain, so that helps. It makes us live a good long time. But everything is dying, so the purpose of this kind of medicine is try to slow it down. We can't stop getting old, of course, completely, but we try to put a damper in it, slow the process down by changing the lifestyle and doing things that make it better. That make our cells live longer and us healthier.
All through history, there's always been the search for the fountain of youth. And I guess this is the closest that we can get to the fountain of youth, regenerative medicine. So let me ask you this. At what age is it a good time to consult with somebody like you that's in this field to start reversing this aging process?
We believe in the earlier mid 40s is good. And because that's when you start diagnosing, at least for the examination, where you find out how the person is, because we don't know how bad we are or how good our health is either way until we check it, because we feel good. I noticed that a lot of the people that I see, a lot of the clients we see, patients, they feel good, but when we check them, they already have 3 or 4 deficiencies in their glands. They have hypothyroidism, they have decreased testosterone or estrogens, hormones are down, and they feel great because the body adapts to that very well, and until the process advances. So if we get it early, then we can make a bigger difference, because if we get it later, we can still help them, but a lot of the damage has already been done. Like
So
bone loss.
there is no really age limit that says, "Oh, I'm too old to start," looking at somebody to help me with regenerative medicine. Is there?
No, not really. There's always something that we can help with. I mean, the younger that you start, the better. But yeah, we can always help people. Correct.
So walk me through the process. You said, obviously you have to do a lot of, blood work and a lot of testing for the different levels of I guess, thyroid levels,
Hormones.
testosterone levels, as you mentioned, and all the hormones that are out there. But what do you do after that?
Okay, the main thing, we have questionnaires that we use that have the symptoms, and a lot of it's about a 2-page questionnaire that has a lot of the symptoms that people get that they don't even know what they're related to. Just the amount of energy you have, do you sleep well, if you don't sleep well, if you snore, don't snore, if you're, all the sexual history. There's a lot of things that we ask in this questionnaire. And so based on those questions, they're directed to if it's a thyroid problem, or if it's an ovarian problem, a testicular problem, or pituitary problem, growth hormone problem. So there's these questionnaires are usually for that, and they identify where the areas of deficiency are. Then when we do the blood test, we do a complete panel of hormones and different chemicals that we can identify, and then we bring them back. We take a look at them. I take them usually look at them later after, on my own time, look at them, review them, and then we bring the patient back in to discuss all the findings with them. And if there's a deficiency in one of the areas, or not only a real deficiency, but that in all the hormones and all the tests that we have, there usually is a range, right? So all the laboratories and the normal medicine, we have a range. Like, let's say for vitamin D level, which vitamin D is really not a vitamin, it's a pro-hormone. It turns into a hormone in the body. But the normal range for vitamin D, for example, is between 30 nanograms and 100. Well, that's a big range. What is normal? 20, 31, and 29 is abnormal, or is it 89 normal? So in anti-aging medicine and regenerative medicine, we use optimal levels. We don't use the standard levels that the laboratories use, because those are too, but they're just not useful, not as useful at least. So we like to get optimal levels of everything. So we try to aim for the 66th percentile of a person when they're in their 30s. Like a person that's 30, 31 years old is almost in perfect health. They're adults already, mature, things already changed, and they're all the hormone levels. That's a good, healthy person. So when we receive all the hormone results, we want them to be at that level. If they're 50 years old, we try to get them, replace the hormones by using bioidentical hormones. And we try to get them to the level when they were in their 30s, 31, 33, that age. So they start feeling better and better. So that's basically what we try to do.
But it's kind of like a cascade effect, I would think. If you correct an issue and you bring these levels to the point that they were in their 30s, but that's going to improve their energy. That's going to improve their ability to exercise, and when they do that, that's going to improve their overall health. That's going to possibly even help them in
The brain,
losing.
improve their brain function. It decreases that brain fog people get, because the reason some of the people start getting very tired and lazy and just you don't feel like doing anything, even depression. Depression is caused by neurotransmitters in the brain, but all these things are connected. Like, just for example, the hormone estrogen has over 400. It interferes in over 400 different reactions in the body, and it interferes also in men and in women. So,
Uh-huh.
but it even has to do with the potassium metabolism. So it is very important. So if estrogens are down, then these 400 other reactions that it participates in, they're going to be different. And each one of those reactions has an effect on our genes, on the cells, on the different functions that every cell has, on our mitochondria, on the parts of the cell, the reticulum, that produce the chemicals in our body. So everything goes down. So I tell people, and we have all these hormones. We have thyroid hormones, ovarian, testicular, pituitary hormones, suprarenal hormones. We have glands. We have cortisol. Then all the other cholesterol. Everything else they're all connected. Like all our sex hormones come from cholesterol. So if a
Hmm.
person has some of these statin drugs that we use, if they lower the cholesterol too low, like the cardiologists want, well, that's good for the heart, but then you cannot produce your sex hormones because you don't have enough cholesterol to do it. Like testosterone, estrogens, progesterone, they come from cholesterol. Pregnenolone comes from cholesterol, the main master hormone. So if the cholesterol is too low, you don't have enough substrate to produce the hormones. That's why when we check something, we don't check it like when I used to do just regular medicine, just look at the numbers and try to correct numbers. We look at the whole picture and try to see, well, look, this affects this other part, these other hormones affect this. So we want to, it's like a symphony, like an orchestra, I guess, and it has to play a symphony, it has to play the whole song. And every instrument, I would compare it like a hormone. Every instrument, the guitar, the trumpet, the oboe, the violins, they're like different hormones. And if they all play correctly, it produces a symphony, right? And it has to be all, and someone's directing all this, like the what do you call it? The music director,
Conductor,
the
right? The
conductor. Yeah,
conductor.
the conductor has to be to a certain degree in the body. It's the pituitary gland, but as we get older, then we need to have someone like us that helps direct the whole thing. But that's basically the fundamentals of it.
So I've been doing some reading about some of these issues, especially with the statins, that they feel that we've probably gone, like you mentioned earlier, too far by getting it too low. Yes, you're right.
Mm.
The cardiologist says, "Oh, that's great. Your LDL is in the 70s and stuff like that." But when you take from it's like the old take from Peter, you got to
That's
pay
right.
Paul.
Yeah.
So that kind of makes the situation a little bit different, and so it affects something else, and
Hmm.
then it probably slows down some other aspects of it that we don't need. Are we
Yeah.
taking any other medications in trying to treat some of the issues, like, for example, diabetes or hypertension, that could be affecting some of these issues that
Well,
are throwing things out of whack?
yeah. Well, almost like diuretics do. Diuretics decrease the amount of magnesium, the amount of potassium in the body, and so. But the statin drugs that we use that are very useful for cholesterol, they use up all the uh, the CoQ10 enzyme of the liver that the liver produces. The organs that have the most CoQ10 enzyme is the heart muscle and the liver. These are two very important organs. You have the heart and the liver. And when you use, in some people, see, and a lot of it's genetics, because some people do very well with anything, no matter what you give them, they feel great. But some people
Right.
are more delicate because a lot of it's genetic differences that we have between people. So if you take some of these statin drugs and not replace the CoQ10 because your diet is not good, you're just alive. Well, that depletes that, so your liver cannot function well. It cannot metabolize all the different chemicals and produce the hormones and vitamins that it needs, because the liver is the laboratory. We eat the food, and the food just looks just food, protein and particles. The liver converts everything into useful proteins and vitamins and coenzymes and everything else. And we don't know exactly how this thing works because it knows everything that the body needs. And so, what I recommend anybody that's taking um, statin drugs should have coenzyme, CoQ10 enzyme, and they sell it everywhere now. But we started that with the movement of anti-aging and regenerative medicine. We're the ones that brought it to the forefront and published all the articles and said a lot of people get in trouble. They develop liver disease because they're not using CoQ10 and they're taking all these drugs that the liver can't metabolize. And then the heart muscle, the heart uses it. CoQ10 is used in the Krebs cycle also of the heart, the energy part of the mitochondria. So it needs CoQ10. So we don't want to deplete it. So, and those kind of things. So when we look at the patient, we look at all these things. See that normally in allopathic medicine they never taught us. They don't go into all those things. Or maybe they do now. But remember, I studied a long time ago, so maybe they go into all those things now. But
So one of the dangers that when we talk about some of these things is that people will only listen to hear a little bit things, and they said, "Oh my gosh, he said the statin drugs are bad, and
Yeah.
so we need to stop taking." No, that's not
Oh,
the
I got
idea. That
something
we're there.
that's
Oh, that's the last thing we want them to do. You never
yeah,
stop any of the medications that you're
yeah,
taking that your doctor has prescribed. Let them decide. Okay, let's do this so we can fix that and go
yeah.
on
There,
for that.
yeah.
That's
It's
what I was
working along
on.
with it. Yeah.
Yeah. So I one of the things that is that I think about also having been in the insurance business is that many of these things that you're bringing to the table in regenerative medicine, is that covered by insurance?
Well, some of it is. If you have a diagnosis, remember you have to have a diagnosis for it to be covered by insurance or Medicare. But most of it, some of it is not. The main hormones are, if you're menopausal, well, they're going to cover just the basic hormones. But when we do the workup, we do a little bit more. I need to see how the growth hormone is. I need to see other things. They're not expensive though anymore. With all these new laboratories, they're so good and they're not that expensive anymore. But so it covers a lot, depends on your diagnosis. Now, if you're healthy and you're in your 40s, which most people are, then it's not going to cover any of that. But I tell people it's worth it, because I tell them, how much do you pay for a cell phone? How much do you pay for your car? It's worth at least one good exam where you check everything out and make sure that you're in good condition. Because once you lose your health, how much is your health worth?
And it's like they always say. I mean, it's better to maintain your health than try to regain it,
Oh,
and
yeah, yeah.
and that's the very important thing. So even though a lot of these insurances will not cover the replacement of some of these hormones, um, it's still a good idea to go, like you said, spend some money. Maybe instead of going out 2 or 3 times a week or 4 times a week to eat
Yeah.
out, maybe spend a little bit of money on your health, because I think that's important. And not only are they going to feel better, they're going to be more productive.
Mhm.
And those of us that are already 55 and above, we can't afford not to do some of these things at this particular point, because we're going to be in trouble eventually, and that's the most important thing.
Yeah.
What do you recommend? Like I said, how difficult is it to see somebody like you, or are there other physicians in here in South Texas that are practicing regenerative medicine? I mean, you're obviously the leader because, like I said before, you've been doing this for a long time.
I've heard that there's other doctors that have studied this as well. That have gone to the institutes to become certified in this. I can't remember who, but there's a few. Now for hormones, a lot of the gynecologists have gotten into this now. When I started this, Roy, there was nobody did it. In fact, they were afraid of hormones. The papers that were published by the Menopausal Society, they were against hormones. They were very negative a few years ago, and our organizations really, they wrote a lot of papers and to counteract that bad propaganda. But a lot of women's and a lot of doctors stopped giving hormones, and that's terrible because a lot of people suffered for years because nobody wanted to give them. I always kept on giving them because we have all the documentation, we have all the training, all the documentation that we use bioidentical hormones. The kind of hormones that they were using back then are the manufactured. These are artificial hormones. So they're the ones that are harmful, and they're the ones that were being used for the last 50 years. That's the ones that I grew up with, that they taught us those in school. But they're artificial. They're not natural. So they're the ones that cause vascular problems, clotting problems, and heart attacks. But when you use natural or identical as the natural ones, why would you get in trouble? It was never logical to me when they would explain it to me, because when you're young in your 20s and 30s, your hormone levels are way up high and nothing happens. That's when you're the healthiest. They used to
Right.
think testosterone caused, we couldn't give testosterone to the older folks because it might cause prostate cancer. Well, that's been debunked. It's baloney. It's not true. And when I went to train back then, they said that's not true. All the research that we have shows that it's not. On the contrary, it decreases prostate cancer by having high levels, good levels, normal levels of testosterone. There's less strokes, less heart attacks when you have good levels of testosterone. You don't have, then osteoporosis doesn't occur because See, testosterone, it does a lot of good things for you. It maintains your bone strength. It builds up your muscles, and muscles decrease the insulin resistance. There's in the old days, and then when I was going to the training, you find out in the research that in the 30s, way back then, almost 100 years ago, they used to treat diabetes in men with testosterone, the 30s or 40s, around there, because they didn't have anything else, and they managed to get diabetes the control pretty good with just testosterone because it builds up muscle and it decreases insulin resistance. It improves the insulin sensitivity. So a lot of people were treated like that and they did well. So the bigger the muscles are, there's a lot of the older folks now, a lot of our generation is, well, some of them are getting very lazy because of the social media, and television is very good now. When we were young, Roy, television had only 3 channels and
That's right.
they stopped at midnight or in the late evening. So everybody got enough sleep. Nowadays, these things, people are up all night, 2, 3, 4 o'clock in the morning, watching all this stuff, and their health is suffering because this is good for the public to know. You're here, all the people that are on the podcast. If you go to bed after midnight, we don't produce growth hormone. Growth hormone is produced by the pituitary gland and produced in pulses in a certain way only, and it does it around midnight. So the recommendation is for people to go to sleep before midnight, because once we're awake, it doesn't produce anymore. And so people might have low growth hormone, which is very important. It's another anabolic hormone similar to testosterone, DHEA. It's an androgen type hormone, but it's for both men and women. We both have it, and it's very important. People that have low growth hormone get very obese very easily also. They can't lose weight. That produces brain fog. It produces a lot of problems. So that's why we analyze all the things. Like, there's another example I want to give. Like, when I ask people, what is the organ that uses the most testosterone in our body? And everybody is like, well, they don't know. Maybe our genitals use it in men for sex. Well, I tell them, they're all surprised when I tell them the organ that uses the most testosterone, that needs it the most, is the brain, the male brain. So that's why men think different than women. We're not the same genetically by any means, So testosterone makes you think logical. It makes your brain function the way males are supposed to function. Women have estrogens and progesterone, more estrogen, so their brains need estrogens. And so in order to function correctly, when the levels of testosterone are low, like I saw a patient today, you'll not believe this. This guy's in his late 40s, early 50s, I think, yeah, about 49, 50. And the testosterone level is about 250, 257. That is very low. We're supposed to have about 450 or more to function. So I have to place him on injections, replacement therapy. But if I don't do that, they start losing their muscle mass. It's called sarcopenia. And once you lose your muscle mass, remember that the heart is almost all muscle and cartilage. It doesn't have any bones and no parts other than muscle and cartilage. So when your testosterone is low, your heart's going to be weaker also. So you develop more heart attacks, you're more prone to problems. But you don't have a lot of it like the bodybuilders. They take too much testosterone, so they mess up their liver and everything else. It all has to be in balance. People, it's like the Oriental medicine. Something I like about Oriental medicine when we go through some of that in our training, that they're always thinking about balance. They're always balancing things out, and I think it's important because otherwise we're out of balance. You're going to be sick.
Okay, so like we start talking at the beginning, that I'd like to keep it to a certain amount of time, and only because we lose the attention span, and we're, I know I'm convinced now more than ever before, even at my age, when I'm gonna be 71 in August,
Yeah.
that
Oh my
when
God,
I
we're
was
still-
when I was growing up, I had to have ADD. I had to have been ADD, and I'm still to some degree. I have attention deficit disorder. How do we get in touch with?
testosterone.
Pardon me.
You need testosterone. Then that helps the
Oh,
brain. That helps a lot with the thinking process and stuff.
how do
Attention.
we? How do somebody listening to the podcast get a hold of Dr. Sanchez or set up an appointment to see you so that they can get this thing started and improve the quality of life?
Sure, they can call us at Boutique Medical Spa. The number is very simple: 664-1234. 664-1234. 956, obviously. 664-1234. And
No,
you know
that's
what, Roy? Next time, what I'll talk to you more. Also, I'm doing IV exosomes and IV stem cells. So that's
I did want to get into that, but it's unfortunate that we don't have enough time to do it this time.
we'll do
So
another
you're
podcast
going to
on
have to come back. We're going to have to come back maybe at least once a month to do that,
that.
because I've also got something else that I want to discuss with you about IV therapy.
Sure,
But
sure.
really, thank you for joining us today, because I really do appreciate on such short notice, and this is one of the areas that I really am interested in, and I'm sure there's going to be a lot of people that are interested
You're
in
very
that
welcome. It
aspect.
was fun, and I hope that the listeners get something out of it, and they can call me, and I'll be happy to help them.
Okay, so let's again, thank you very much. I appreciate it, Dr. Sanchez. We'll get his number, we'll post it on it so that you can have it. And that's going to wrap up our episode today of 55 Plus The Perfect Years. We've explored this fascinating world of regenerative medicine and its potential to revolutionize healthcare for the 55 plus community, from stem cell therapies to tissue engineering. These groundbreaking advancements offer new hope for managing aging and chronic conditions, helping us maintain vitality and improve our quality of life. Remember, staying informed about the latest medical innovations can empower you to make the best choices for your health. If you're considering regenerative medicine treatment, be sure to consult with a medical professional like Dr. Manuel Sanchez to understand your options and ensure the best outcomes. Thank you for joining us today. If you found this episode helpful, please subscribe and share it with others who might benefit. For comments, please email me at 55plustheperfectyears at gmail.com. Stay tuned for more insights and tips to help you enjoy your perfect retirement years. Until next time, take care, live well, and remember, getting old is a privilege not everyone enjoys. So let's make getting old fun. It's better than the alternative. And we'll see you again on 55 Plus The Perfect Years.